Hey, I'm back. Dr. Stephen Bradley, your friendly neighborhood anesthesiologist, medical ethicist, critical care physician, Navy veteran, podcast host, even host of the Black Doctors podcast. A lot of those things, but I am here. I have my camouflage on to talk about military medicine. It's a topic that I've had multiple times. I still get a lot of questions about this, mostly from an interview I did with Dr. Antonio Webb on his YouTube channel. I talked about kind of life as a military physician, and mostly that was talking about the salary of a military physician and reimbursements, how much money you make. So I get a lot of questions from that, and then I'm just always an open book when it comes to my experience in the service and practicing medicine on active duty. About myself, I am an anesthesiologist by training. I'm currently completing a critical care medicine fellowship. I am a Navy brat, moved around a bunch. My dad is a retired surface warfare officer. My little brother is a surface warfare officer as well. Currently, he is still on active duty. He joined through the ROTC pipeline. I wanted to join using the Health Profession Scholarship Program. I applied in medical school. I was a little too late for the application, did not get in. So during residency, I joined using the FAP, or Financial Assistance Program. I served for 4 years in active duty. I was stationed in Virginia. I did anesthesia in the Navy. I have an academic appointment still with the Uniformed Services University of Health Science. These views are my own, not those of the DoD. After 4 years of service on active duty, I completed my service obligation in July of 2022 and went back to complete an ICU fellowship. So happy probably in other videos to discuss kind of why I went back and why I did fellowship outside of the Navy, why I didn't prolong my commitment on all those other things. The goal of the very quick video for today, I'm talking about the two reasons why you should join the military and become a military physician. The only two reasons, in my opinion, only two reasons to do it. The first reason, number one, is that you have a very, very, very intense passion and desire to serve your country, serve your fellow service members. And number two, you have a pre existing service obligation. I'm going to dig a little deeper into those reasons. So, number one, you have a desire to serve. That's usually the reason people say when they talk about wanting to become a military physician, wanting to apply to USIS, Uniformed Services University of Health Science, wanting to look into the Health Profession Scholarship Program. I want to serve my country. I want to serve my country. Now, what does that mean? I think for a lot of medical students out there, it's so hard to really describe, you know, what life is like as a military physician on active duty. You just don't get it until you're actually involved in it. So I know like you're probably going to watch this video, but you'll still feel differently about it until you've experienced it. You don't really know what you're getting into. This is evidenced by the fact that you can go on Student Doctor Network and there's going to be a ton of comments and conversations about life as a military physician. Just for years since Student Doctor Network has existed, you can go on those forums and talk about military medicine. Reddit, more recently, you can go on Reddit and there's going to be a ton of people asking the same questions. What is life like? Should they do this? Should they do that? Should they go into this specialty? So I'm going to describe, I'm not even going to really describe aspects of that, but your desire to serve should be so strong that you are willing to overlook the significant gap in salary and income as a military position. It's hard to find the numbers. I broke that down further in the video with Dr. Antonio Webb. But as an anesthesiologist coming straight out of civilian training, you're probably going to be making somewhere between the 120s and 150s range for that first 4 years. That varies by like 20 or 30,000, depending on, if you did your residency in the military or not. So you're looking at, 100 and you can call it, I think as when I got out after the 4 years, I was clearing about 140, 150,000. As opposed to all my colleagues when starting anesthesia jobs are easily between 380, 400, 420,000. So that's how much you need to love your country and desire to serve. They're going to say all these things about, oh, you don't pay for malpractice insurance. Well, those jobs that I mentioned that are 400,000 a year, malpractice insurance is pretty much included. People talk about, oh, part of, they'll say things like your salary is untaxed. That's not true. A portion of your salary in the military is untaxed. As I was getting out, there's actually a calculator that can you can plug in your salary and your BAS. That's like your um, housing allowance and your food allowance, and that's the part that's not taxed. You can plug that into a calculator, and based upon how much I was getting, I was saving about the equivalent of $10,000 a year because of that money not being taxed, right? So 10,000 a year is equivalent of a couple of shifts as a civilian anesthesiologist. So that is how badly you need to desire to serve that you're going to say goodbye to hundreds of thousands, eventually millions of dollars over the course of your career, depending on how long you're going to serve. So that's a dollar amount. You have to be okay with your analysis. This is something that, yeah, I don't do weed or whatever. It doesn't affect me. So eventually, and this is over the 4 year service period, you have to submit to random urinalysis. What does that look like as an anesthesiologist? I want to go into work. I want to start my cases with no delay. There's a satisfaction in just doing anesthesia and being, having a quick, efficient start to a case. Well, God forbid your name pops up on the urinalysis list. There's going to be an email that goes out about 7 o'clock in the morning, 0700. If your name's on the urinalysis list, well, you've got to stop everything. And usually by like 1 o'clock or 2 o'clock, you need to go pee for your country. That's what we called it. So that meant finding some time in between the case, having a partner cover the resident in my room or finding somebody else to cover my room, and then going downstairs to the urinalysis place and waiting in line because sometimes there would be no line, but usually there's like a 20 to 30 to 40-minute wait to perform a random urine drug test. And you have to stay down there until you pee, obviously. So you're like walking around. So hopefully you're able to use the bathroom. And then when that's all said and done, like they don't care that you have patients that are waiting to have their surgery. You could be the surgeon. Maybe you go into neurosurgery or ortho, whatever. It doesn't matter. At some point, you're going to have this random drug test and you're going to have to drop everything and go do that. First time, sure, that's fine. This is fun. This is interesting. Second time, okay, it's a mild inconvenience. Third time, fourth time, fifth time. Over time, this just starts to grate on you and realize that this is a true impediment to providing good patient care. So that's how much you have to love your country if that's your reason for joining the military. Number one, this isn't really a number. Other things are like if you like to travel, if you like to leave the country, um, you have to receive different levels of information. You have to apply for leave outside of the continental United States, OCONUS leave, that gets routed through about 3 or 4 different people that have to sign off on this, right? So you're planning a vacation, you have to plan for it like 6 or 8 months in advance because you're going to have to submit paperwork through your chain of command. You get the leave booked, and then you're supposed to submit this other request form that goes up to like the admiral that is over the combatant command, so that the world is divided up into like these combatant commands, and they have like a admiral or general in charge of them. So you have to submit a request that goes all the way up to their offices for permission. So one of the times I would go to Portugal or to Spain or wherever, and God forbid there's any kind of like hostility because in the military would be like, no, you can't do this. Or during COVID, it was a hard pass. Obviously, the world shut down during most of the pandemic, but for parts of it, even though the threat would be gone, you would still be barred from going to that place, because the government just kind of drags their feet. So that is how much you need to love your country, that you want to go through all these hassles. I just had a wedding reception in Mexico. My little brother could not come. He, at the last minute, got his leave approved, but he did not get his country clearance approved and was not able to make it like the day before he found out the news that they hadn't approved it. Those are just a couple of the more minor inconveniences. Another major inconvenience is, you can't leave your job, right? If you're in the civilian world and your job sucks or they aren't paying you enough, you can just go next door or you can go move and find other employment. Obviously, you're locked in to your commitment with the military. So that's the number one reason why you should take a scholarship, is if your desire to serve your country is that strong that you're willing to put up with all that stuff. To put other things in perspective, thank God we're not currently at war. Is 2023 January. So a lot of this stuff overseas has died down. So people will have these visions of going and doing battlefield medicine and combat and all this stuff and saving lives and like the war movies you've seen. And thankfully, right now, people aren't getting really hurt downrange. But like the last couple of deployments that some of my partners went on, we're talking about sending an anesthesiologist, a nurse anesthetist, an orthopedic surgeon, two general surgeons, um, some OR techs. I think I mentioned orthopedic surgeon, a couple of emergency medicine physicians. This is the unit that deployed. And for 7 months, they sat in the desert and did a total of 6 operative cases. There was like one gunshot wound to the foot, one accidental gunshot wound, and then like some lumps and bumps. Maybe I think somebody swallowed a fish hook or something. So that is the quality, or that's the type of work that is currently being done downrange. Now I'm sure, like in Syria, there was some stuff going on a couple years ago, and in um, the Ukraine, Russia, there, who knows, I'm sure there's some like spooky stuff, some top secret stuff. But for those of folks that want to join because they want to save lives in the battlefield, thankfully there's no real battlefields that need lives being saved on at the moment. So again, you end up at your civilian medical or your medical or military treatment facility in these states doing bread and butter cases. So again, the number one and two reasons. Number one, you should join if you love your country and your desire to serve your country is so great that you're willing to put up with all the things that I just talked about. The second reason is a little shorter, that you should consider joining. A good reason is if you already have a prior service commitment or obligation, or you've already served in the military. So a lot of the residents that I would have, they had a prior life. I worked with a couple helicopter pilots, some fighter pilots. Um, so if you're in the military already, maybe you fly planes for 8 or 10 years, you've completed your service obligation. Well, now if you go into the military, you do the health profession scholarship, or you do the FAP, or you go to the military medical school, you're going to have a little bit of bump in your rank and your pay based on your time served. And more importantly, by the time you finish your service obligation, which will probably be about 8 to 10 years, you're probably very close to, or you will have reached enough time to retire. And that's a nice bump. So a lot of my colleagues would have completed their service commitment and finish their training. And yes, they're a little older when they go through medical school and when they complete residency, but by the time they're done with their service obligation, they can just go back into the civilian world and practice and have that retirement. I had residents who were fighter pilots, helicopter pilots, flew bombing missions during the war, Navy special warfare, submariners. So it's a cool way to like have a second part to your career if that's something that interests you. And again, all those benefits are going to be there, and you're going to be able to take um, full advantage of all of those benefits that you already started to accrue with your military service. And you also know what you're getting into because you've been in the military for that long. So leave in the comments any questions. I'll try to get back on and answer those questions. But happy to chat. I just wanted to. I'll probably try and take some of the questions that I get more frequently, and make these YouTube videos so I can just direct people here and not have to like go back and forth so much in the emails. But you can definitely visit my website, www.stephenbradleymd.com. I think there's a drop down menu where you can ask questions about medical school. You can ask questions about military medicine. You can also visit the podcast website, www.theblacknectarspodcast.com. That's another project that I have where every week I put out an episode that kind of it revolves around representation of underrepresented minority physicians. People are sharing their stories. We're sharing tips on how to succeed as minoritized healthcare professionals. You can also follow me on Instagram and or Twitter at Stephen Bradley MD. Instagram is mostly my music stuff. I do music. I may or may not put music on this video. And yeah, feel free to hit me up on or offline. Hopefully these videos help. If you know somebody interested in military medicine, send them this and help a brother, help a sister out. So I am Dr. Stephen Bradley, your friendly neighborhood anesthesiologist. Until next time.